Cardiogenic, thank you guys for those emoticons. Cardiogenic syncope is a subtype which includes all etiologies that arise from within the heart. Now, these include both bradyarrhythmias as well as tachyarrhythmias, although the only tachyarrhythmia really which causes syncope is the beloved ventricular tachycardia VTAC. Most other tachyarrhythmias typically present with palpitations instead. Cardiogenic syncope also includes mechanical etiologies, right, such as aortic stenosis, hypertrophic obstructive cardiomyopathy HOCM, or a really, really massive pulmonary embolus, which can cause hypotension. All right, then we have this gentleman here. He says, I don't always stand up quickly, but when I do, I pass out. Oh dear. That, my friend, is a description of orthostatic syncope. Aha, the third category, right? So the last major subtype within our framework is what we call orthostatic hypotension. This is a situation in which a patient's blood pressure precipitously falls upon standing. It is arbitrarily defined as a presence of either a systolic drop in excess of 20 millimeters mercury or a diastolic drop in excess of 10 millimeters mercury when moving from a lying to a standing position. Orthostatic hypotension can be divided into volume depletion from any cause, medication side effects, in which alpha blockers, antidepressants, and antipsychotics are most commonly implicated. And then we got the phenomenon of autonomic failure, right? As seen in Parkinson's disease, diabetes, watch out for that one, quite common, and alcoholism, along with many other conditions. Remember that what maintains vasoconstriction is your sympathetic nervous system. If your autonomic nervous system is malfunctioning for whatever reason, most especially secondary to neuropathy in diabetes, your patient is prone to having postural or orthostatic hypotension, right? Also, it's a good idea to check what medications they're taking, because alpha blockers, if those are part of your blood pressure arsenal, or even if you're just overly or overzealously diuresing your patient, that may also predispose to orthostasis. Aha, what's happening here? This is what we call a tilt table test, all right? And what happens, remember, when a patient's blood pressure falls, the compensatory response should be a tachycardia. That is how you know your autonomic nervous system is functional. But what's happening here? Note at the transition point here, right, where you're having this drop in blood pressure, right? So the image on the right, or the graph on the right, is just a magnification of what's happening in this area. As the systolic blood pressure is dropping, you expect there to be a commensurate tachycardia, but it's just not happening. The heart rate is just not increasing.